Hi, my name is Dr. Stephen Chavoustie. I'm a board-certified obstetrician gynecologist with many years of treating patients with endocrine disorders, in particular Polycystic Ovarian Syndrome. Polycystic Ovarian Syndrome is one of the most common metabolic endocrine medical conditions in women. It's prevalent in about 5 to 20% of all women. There's a genetic component, which means that if you have a family member, mother, sister, aunt, you may have an increased risk of polycystic ovarian syndrome. Currently, there's a lot of speculation on the cause. There's a genetic component to it, so you have a genetic predisposition, but the cause is actually a hormonal condition that may be related to genetics. The hormonal condition is a dysfunction in the pituitary gland and the hypothalamus part of the brain, which is the control system for your hormone system in your body. So what patients have PCOS? Polycystic ovarian syndrome we know is a genetic disorder. Patients who have a strong family history for it may be predisposed to it. It usually presents after a girl goes through her menses, beginning of her period, and in her teens. It presents with several different types of presentations. It can present with being overweight, obesity. It can present with hair growth on their face, on their cheeks, on their chests, in their inside of their thighs. And in women who are trying to conceive, it can present as infertility. It can also present with acne. So these are the main presentations that women will present with. Most common symptoms for PCOS is what we call oligomenorrhea or anovulation. What does that mean? Irregular periods. Normal period is between 21 and 36 days. Patients with PCOS will sometimes have periods every 3 months, every 6 months. So irregular periods is one of the more common ones. Obesity, BMI over 30, acne, facial hair, and infertility. These are the most common presenting symptoms. So can a woman get pregnant with PCOS? Yes. However, they're going to usually need reproductive help. And the most common medications we use for treating PCOS is a simple medication that is used for diabetes called metformin. And then if they're trying to get pregnant, we first have to cause them to have a period. So we will stimulate them to have a period with a simple drug called progesterone, not an expensive drug. And then the second drug that we'll use is clomiphene citrate, which is a fertility drug. And we'll treat them for 5 days of the month with the clomiphene citrate. And this has usually got very good success for pregnancy. So yes, they can get pregnant, but they need reproductive assistance with getting pregnant. The question is PCOS linked to other health problems? And yes. So let's talk about all of them. Obesity. So what goes with obesity? Patients can be predisposed to diabetes. With PCOS, patients have an issue with their insulin. They make too much insulin. So in this population, if they make too much insulin, they will, one, increase their risk for being obese, but increases their risk for type 2 diabetes. Secondary, they'll have excessive hair growth. So they'll have acne or hair growth, and that is one of the medical conditions that we treat, and it's usually one of the more distressing medical conditions. If they're obese, they have increased risk for high blood pressure, for cardiovascular disease, and since they're not ovulating regularly, they can have increased risk for endometrial cancers. So these patients have to be followed very closely by gynecologic surveillance to make sure they don't develop endometrial cancer. The current recommended treatment for PCOS is looking at the whole disorder in its entirety. So first thing, let's talk about the hirsutism. With the hirsutism, we want to turn off the hormone that actually is producing the extra testosterone. Simple way to doing that is with oral estrogen, progesterone birth control pills. We also use a medication that's used for blood pressure called spironolactone, And that medication will actually work at the testosterone receptors in the skin to help turn off the production of testosterone in the hair follicle. So we treat the excessive hair growth. For the acne, we would use standard benzoyl peroxide and the acne medications. Like we said, we were talking about infertility. We would use fertility drugs such as clomiphene citrate. Well, there have not really been many research trials in PCOS. So we're fortunate that companies are now starting to look into PCOS since it's so prevalent. The prevalence is, as we mentioned before, is somewhere between 5 and 20%. So we need to have more research into this disorder. We see PCOS in patients who are Hispanic, and since we have growing Hispanic populations in America, we're seeing a lot more PCOS in America.